Do you know that Scarlett Johansson has experienced social anxiety disorder before in her life as an actor? Not only her, many people are facing the same problem as well. In fact, social anxiety disorder is one of the most common type of anxiety disorder. Watch this video to find out more about social anxiety disorder. It is pretty normal for us to feel shy or even nervous on social occasions like joining a party that is filled with plenty of strangers, or going up onto the stage to deliver a speech, or even as simple as going for an interview. However, not everyone is capable of handling this tremendous amount of pressure and yet still stays functional. This group of people is usually diagnosed with what we call as social anxiety disorder. Social anxiety disorder is a type of anxiety disorder that is characterized by an irrational and extreme feeling of fear and anxiety of social occasions where embarrassment may occur. People with this disorder are very afraid of being judged, embarrassed, and humiliated by others for the way that they act. They are also very concerned of accidentally offending someone or even being pushed into the center of attention. Normally, under these circumstances, they will show various symptoms such as rapid heartbeat, muscle tension, sweating, nausea, and etc. Unlike other mental disorders, social anxiety disorder is affecting both men and women equally. However, only under one condition whereby it is affecting more men than women. In Japan, this condition is known as taijin kiyofusho, whereby the victim is afraid that his presence would offend someone nearby them because of their physical appearances, body odor, and others. Like other mental disorders, psychologists can't exactly pinpoint the exact cause for social anxiety disorder. However, a few possible causes are proposed by the psychologists. Speaking from evolutionary perspective, humans are born with an innate fear of dangerous situations. Similarly, we might be born to fear people with angry faces and people who are critical because it increases our odds of survival by avoiding angry people in our life. And such condition may be more apparent among people who suffer from social anxiety disorder, because study has found that people who suffer from this disorder tend to recognize angry faces more quickly compared to people who don't suffer from this disorder. On the other hand, people who suffer from social anxiety disorder may be genetically and psychologically more vulnerable to develop this disorder. In other words, some people are born to be more socially inhibited. For example, they are more likely to experience distress from unfamiliar situations. They may also have an innate belief that things that happen around them are uncontrollable. Therefore, whenever they are put under stressful situations, they may be more affected by social anxiety compared to the people around them who don't have such vulnerability. Moreover, the chances of developing social anxiety disorder increases among people who have learned growing up that social evaluations can be dangerous. This is because it further enhances the person's psychological vulnerability to develop this disorder. I have mentioned in one of my previous videos that cognitive behavioral therapy, or in short CBT, is one of the most effective treatment for any kind of anxiety disorder. A special form of CBT for social anxiety disorder patients is conducted in group. This is because it allows the patient to participate in role-playing session that aims to expose them to potential stressor. At the same time, therapists will try to change the negative perceptions of their clients. For example, people who are afraid of doing public speaking on the stage, the thought of presenting a speech on the stage would already be enough to elicit a fear of embarrassment and also a fear of making mistakes on the stage. Therefore, the goal of the therapy is to change these hardwired negative thoughts into a more functional one, such as thinking it is okay to make mistakes on the stage because it is just part of the learning curve. Furthermore, certain therapists do prescribe drugs for patients who suffer from social anxiety disorder. For example, monoamine oxidase inhibitor, or in short, MAO. Even though drugs are useful in treating people with social anxiety disorder, but in comparison to therapy tends to produce a better and a more consistent outcome. In conclusion, social anxiety disorder is one of the most common type of anxiety disorder. It is characterized by an extreme feeling of fears and anxiety towards social occasion where embarrassment may occur. Though we can't pinpoint the exact causes of this disorder, but it might be due to a person's biological and psychological vulnerability. Lastly, CBT is found to be highly useful in treating patients with social anxiety disorder compared to the usage of drugs. That's all I have for you guys today. Thank you so much for watching my video. Again, remember to give this video a thumbs up and also share it out with your friend. Let's say if you are interested in psychology and mental health content and information, then remember to subscribe to my channel for more. Till then, I will see you guys in the next video. Bye bye!